Well, this is Cancer Awareness Month, and one of the areas many patients don't know too much about or don't think about ahead of time is their dental health and how to preserve it through treatment to avoid serious repercussions later on. So joining us now is an expert on that topic, Anaida Deti, the owner and founder of DentalX Smile Centers. That includes Toronto's first Tooth Fairy headquarters, right? And she is going to join us this evening to share some things we should all know. So welcome to What She Said, Anaida.
Thank you.
Well, dental health usually isn't the first thing that people think about. They get the diagnosis, they come home, they're in shock, they're thinking about, what am I going to do with my kids? What am I going to do with my life? And you're saying, get somebody to figure it out for you, even if you're not doing it, right?
Yes, it is very, very important for the cancer care team to include a dental professional. So you cannot have a proper treatment for the cancer patient without having a dental professional in staff.
Now, you're a person who would have seen the repercussions or the consequences when people don't get that lined up ahead of time. What are the possible consequences of not taking care of your mouth?
You can have a lot of problems, especially one of the most important things is that you can actually, if you have a lot of infection in the mouth during the cancer treatment, you can have the patient stop the treatment. So if the infection is too severe, the patient will have to delay or actually stop the treatment until all the infection is gone in the mouth. And you see also after the treatment, you see a lot of problems going in the mouth. You have infection, you have severe cavities, and for sure ulcers in the mouth, dry mouth, a lot of things that you can see.
So is it the cancer or the treatment that causes the most problems orally?
Is the treatment. Is definitely the treatment, especially if the patient is having head and neck radiation. Definitely is going to damage the salivary glands, and that's where you see severe dry mouth, where it's going to bring all the problems after.
Well, I know a number of people who've gone through chemo and then had to go and spend a whole lot of money because they didn't go to see somebody ahead of time and do what they should have done. And they spent thousands of dollars replacing teeth, etc.
I got to admit, I never thought, it never occurred to me.
Nobody does. Nobody does. I actually had a patient not too long ago, and this patient had actually gone through not once but a few times cancer treatment in different areas of the body. And when he came to our office, you couldn't even imagine his status of mouth. And he came for 3 months, once a week. And he was so religiously coming in every week to our office, and the problems were huge. But at the end of the day, thank God, he made it, and it was pretty good outcome of his dental care.
So, imagine you get the diagnosis. What would your ideal scenario be then for that patient? Whether it's them doing it, or their spouse, or their parent, or...
So definitely the first thing that should be is to see a dental professional before they go through cancer treatment. And then the dentist and the dental hygienist will evaluate their oral health. And then they will decide what kind of treatment options they have to do. And also one of the most important things is also because the side effects of the treatment are so severe. And that's why if you take care before the treatment, it's very important because the side effects will be less severe.
What do you mean by take care?
Like take care would be like having definitely a good dental cleaning, and then probably restore all the cavities that they will have any root canals, restore crowns, bridges, because it is very important also for those patients to get to have nutritional food and chew the food properly, because you can imagine how bad is the cancer treatment and their immune system goes down completely. And then if they don't get proper nutrition through through eating, that's usually gonna also affect their complete health.
What about sometimes I go to the dentist and they put something on my teeth and I sit for 20 minutes. whatever that is.
Fluoride?
Fluoride, yeah.
It's not usually 20 minutes. It's usually a little bit less.
Okay.
So it's with
whatever.
trays.
Yeah.
Yes, so that's fluoride treatment is actually a very important part before the cancer treatment. Because,
Really?
Yes. Fluoride is very good for your teeth. It can prevent cavities.
Do you also suggest nutritional tips
Counseling?
for people to preserve their mouth health?
Of course. I think also a nutritionist would be a good part of the cancer care team.
Is there anything that, because I do know a lot of people get mouth sores.
Yes.
Is there anything that your dental professional can give you to help you prevent those sores or not?
Yes, you can
There
get
is.
topical treatments, and those are usually during cancer treatment. The ulcers are mild, but it can be up to they are severe. And if they are too severe, the patient has to delay the treatment until they are actually completely gone. And some of the things, they definitely can use painkillers to actually just make them a little better. But definitely mouth sores are very common through chemotherapy and radiation treatment.
Typically, how often would a cancer patient then be coming to see somebody like you?
During the treatment is a little bit hard because you can imagine how much of a harder time they're going through physically, emotionally, and psychologically. So I think going to the dental professional during the treatment would be hard unless there is an emergency happening when they would really have to come in. But usually I would say it's probably mostly before and after the treatment that they would need to come in.
Right. So they get everything fixed up.
Yes.
You give them all the things that they may need if they
Yes.
get sores and whatever. And then afterwards, what happens?
Because afterwards, even, they had the best mouth, like before starting the cancer treatment, you would see so many problems happening again. Like you probably will have a lot of cavities, root canals, also mostly of the crowns and bridges that they had, probably they failed. Or even nowadays with the implants, you also might see that they will fail during the radiation chemotherapy.
Really?
Yes.
So what does that do? Does it deteriorate your bones, the bones in your mouth that hold your teeth?
It does. And also the infection is usually that the infection completely destroys everything in the mouth.
It's so funny, right, Kate, that we hear about people losing their hair.
Yes.
And things like that,
Yes.
but we don't really talk about mouth health. And if you don't have a nice smile, that's
also-
very discouraging.
Also, losing the hair is mostly just physically, right? So it's nothing really, it's not doing anything to your body really, like healthy-wise. But the mouth is actually an important part because it's going to affect your overall health.
So what I need to know is this. If you didn't take care, if there's anybody out there who's been through this, they didn't take care of anything, can they still get it fixed?
At some point, probably they can or they cannot. You can't really say that. It's very hard to say unless you really see them after the treatment. And some of them, it's, no question that they might also lose their teeth. It's not something that is, it's not common.
Before we go, because I did mention it off the top, I want you, Anaida, to explain to people what Toronto's first Tooth Fairy headquarters is.
So what we do is usually when kids come in, we let them know that if they lose any teeth, we give them little boxes, and when they lose their teeth, they put these teeth in the boxes and they drop them off at our office, and we send them to the Tooth Fairy, and the Tooth Fairy sends them a certificate with a little present.
That's so cute.
Where were you when my children were? Oh, they would have loved that. They would
They
have
actually
loved
do.
to.
We get the pictures after, and it's very cute, I would say.
And the other thing you do, tell everybody how you help the community, how you give back. Such an awesome story.
We usually do give back a lot. My story was not easy when I came to Canada. So definitely I love to give back. We usually do it's actually a national event once a year that we offer free services for the community. And also what I do in a personal level in my office, we usually give close to Valentine's Day and Christmas. We give free services for kids that are under 18 years old.
That's amazing.
Yeah, that's really kind. So it's DentalX. What's your website so people know exactly where you are?
It's www.dentalx.ca.
DentalX.ca.
And not a separate website for the Tooth Fairy?
No, it's included there.
Okay. Just to let all those moms and dads out there know. Okay.
Tooth Fairy is a very good friend of ours.
Oh, yeah?
So usually she comes and sees us often. And that's why we can definitely refer or give any notes or any messages that anybody can have.
So you cater to all ages.
Exactly.
Thank you so much for joining us
you.
today. This has been so much fun. This is what she said. Stay with us.